Hello, I'm Heather Jade Wright, licensed therapist, and welcome to a new episode of the Mental Health Monthly Update, where we're working towards destigmatizing mental health by increasing knowledge and providing free access to truthful, helpful, and interesting information. To support the mission, you can help by hitting the like button and subscribing. That way, this video and this channel will be more likely to get in front of the eyes of others. Okay, let's jump right into the mental health news. A new study found that watching the movie Joker actually increased prejudice against those with mental illness. The researchers of this study randomly assigned 164 adults to watch the movie Joker or Terminator Dark Fate. Before and after watching their assigned movie, the participants completed an assessment of prejudice towards people with mental illness. The assessment asked the participants how much they agreed with statements such as, "I would feel unsafe being around someone who is mentally ill," and "the behavior of people with mental illness is unpredictable." The study found that after watching Joker, people answered the questions with more prejudice towards those with mental illness. One of the authors of the study, Damien Scarf, states that, quote, "News stories and fictional portrayals of people with mental illness are typically negative and can impact how we view people with mental illness," end quote. Scarf offers solutions to this issue, such as presenting viewers with some facts following the movie, such as stating that most people with mental illness are not violent, and making it clear that the portrayal in the movie is a work of fiction. He goes on to suggest that Hollywood balance out how they portray mental illness, making sure they also put out movies that provide a more positive and realistic depiction of people struggling with mental illness. I saw Joker and I thought that it did a great job of highlighting some of the systemic issues that desperately need to be fixed within our mental health system. For instance, it's really difficult to provide low-income people with consistent, quality mental health care because the funding frankly sucks or it's just not even there. And as a therapist, I already understand and know from experience that most people with mental illness are not dangerous. So I didn't even think much about that while I was watching the movie. I mostly just thought how sad it was that the system drove him to not know any other way out. To me, it showed how the system really let him down and took all his supports away, so he saw no other way out. But I can definitely see how the results of this study could happen when those without direct experience with mental health issues watched the movie. So let's hope that Hollywood will provide some more realistic narratives in the near future to help destigmatize mental health instead of contributing to prejudice. A study led by Penn State University shows that middle age may be more stressful now than it was in the 1990s. Researchers found that those between the ages of 45 and 64 reported about a 19% more stress in 2010 as compared to 1990. All study participants were interviewed daily for 8 consecutive days. During each daily interview, the researchers asked the participants about their stressful experiences throughout the previous 24 hours. For example, arguments with family or friends, or feeling overwhelmed at home or work. The participants were also asked how severe their stress was and whether those stressors were likely to impact other areas of their lives. David Almeida, one of the researchers and professor at Penn State, was surprised by the results of the study, stating, quote, "We thought that with the economic uncertainty, life might be more stressful for younger adults, but we didn't see that. We saw more stress for people at midlife. And maybe that's because they have children who are facing an uncertain job market while also responsible for their own parents. So it's this generational squeeze that's making stress more prevalent for people at midlife," end quote. Participants reported a 27% increase in the belief that their specific stress would affect their finances and a 17% increase in the belief that their stress would affect future plans. Additionally, Almeida said that added stress could partially be due to life speeding up due to technological advances. This could be particularly true during stressful times like the coronavirus pandemic, when tuning out the news can seem impossible. Yeah. Quote, with people always on their smartphones, they have access to constant news and information that could be overwhelming, Almeida said. Sadly, America's suicide rate has increased for 13 years in a row. This makes suicide the 10th biggest cause of death in the United States, deadlier than traffic accidents and homicide. In 2016, the suicide rate was 25% higher in rural and less populated counties, meaning those with fewer than 50,000 people. 15 years ago, it was only 10% higher. Several characteristics go hand in hand with high suicide rates, such as deprivation, which is defined by low levels of education, employment, and income, and high levels of poverty. Another factor is loneliness, and locations with fewer opportunities for social interaction, such as parks, museums, and stadiums, tend to have more suicides too. Easy access to guns also seems to boost the risk of self-harm. Using a database of firearm sellers, the authors of the research study found that the presence of a nearby gun shop was associated with significantly higher suicide rates. American health officials may never find a complete solution to the country's suicide crisis. However, making guns less easily accessible could be a start. Our mental health hero of the month is Taraji P. Henson. She's an actress and author, perhaps most well known for starring in the show Empire. Through her foundation, the Boris Lawrence Henson Foundation, she's providing free virtual therapy to people of color facing COVID-19 stressors. To see Ms. Henson talk about the impact of current issues on the Black community and how to access the free mental health resource, I've placed a link below to the CNN interview that she recently did with Anderson Cooper and Dr. Sanjay Gupta. The Black community is already disproportionately affected by mental health issues. According to the U.S. Health and Human Services Office of Minority Health, adult African Americans are 20% more likely to report serious psychological distress as compared to adult whites. Black Americans living below poverty are 3 times more likely to report serious psychological distress than those living above poverty. And Black Americans are more likely to be victims of serious violent crime than are whites, which makes them more likely to develop a mental health diagnosis such as PTSD. So we know that poverty increases anyone's susceptibility to experiencing a mental health crisis. It's not the lack of money itself that creates the issues, it's the effects that occur due to that lack of money. For instance, less accessibility to mental health or physical health care, less access to a good education, and when we have to be focused on meeting our basic needs, such as finding food and shelter, we are then prone to being stuck in survival mode, which can increase our stress response and lead to having to make decisions that we would not have to be focused on were we living in a more helpful and supportive environment. So it's a complex issue in some ways, but really it ultimately comes down to the fact that we must obliterate racism and give people a better ability to escape poverty. I live in the South where a lot of people are against certain social supports, but we can't expect people to bootstrap their way out of a broken system when the system's very intent is to oppress them. And as we've seen this past week, it's not just oppressing them, it's murdering them. Rest in power, George Floyd. May we as a nation rise above the heartbreaking insanity that has been going on. We have to do better. We have to. I urge you to do your part to speak up and speak out for the Black community, no matter what color you are. I've placed links below with education and supportive resources. Sign petitions, write your government officials, read up, and take peaceful, powerful, decisive action however you can. Remember, just because you don't see something doesn't mean it's not happening. George Floyd's death is an example of an issue that's been happening over and over and over and over again. Denial and ignorance are no longer an option. Thanks so much for watching. I post a weekly video, and this particular segment I post once a month. If you haven't already, as I mentioned in the beginning, please like and subscribe so that more people get access to this content. Thanks again, have a great week, and remember to stay present and breathe.